Bismillahirrahmanirrahim. Dear viewers, in this video presentation, we are going to resume the services at EyeAcuity Eye Center, and I'm going to discuss the standard operating procedures at our clinic regarding COVID-19 update. First of all, the patient is scanned with a wireless temperature gun, and then our staff will offer you a sanitizer for your hand sanitization, followed by a modified COVID-19 related open air screening desk where the staff will ask you certain questions regarding this COVID-19 outbreak and taking the initial history, and immediately the patient is shifted inside. The seating is disinfected with the disinfection solutions after every patient's interview, and once the patient is free from this initial screening, he is free from fever, flu-like symptoms and COVID contact. Assuring this, the patient is shifted to the screening room where as usual the visual acuity is checked with non-contact technique. The patient is asked to close his eyes with his own hands with the help of a tissue paper, and it is followed by auto-refraction by ophthalmic assistant of both eyes, and after gathering these auto-refraction readings of both eyes, the next step is going to be non-contact air puff tonometer, and the patient feels air current, a puff of air in his or her eyes, and the machine automatically detects the intraocular pressure, which is one of the compulsory part of the eye examination. And with this non-contact method is ideal and recommended in this COVID-19 related ophthalmic care. After completing the screening examination, the patient is shifted to the consultation room, and the ophthalmic assistant immediately disinfects the screening room seats with the disinfection solution, as well as disinfection mop soaked with the disinfection solution is being applied to the chin rest and forehead, the parts which have been touched by the patient. The patient is received in the consultation room by the consultant and comfortably sits in the clinic. The consultant may be using a full personal protection suit or an overall with protective goggles and gloves, then the regular torch examination and ophthalmoscopic examination, and the steps of the digital slit lamp examination are performed. And PHOROPTER is used in our facility for refraction, which is not a priority in this scenario, but if at all we need, PHOROPTER is our priority because being a single instrument, it is relatively easy to disinfect on patient's side with the help of a soaked mop again. And after assuring the refraction and the vision status, the consultant moves to digital slit lamp examination. A proper social distance is maintained. The patient is wearing the mask all the time, and the consultant is also wearing the goggles, the mask and the gloves. And there is a protective sheet to protect the consultant and the patient from each other's breath. And then it can be a direct examination through the eyepieces, or the consultant can screen the slit lamp examination of the patient with attached monitor at digital slit lamp. And once all the information is gathered, the patient is requested to leave and wait outside in the waiting lounge, and the waiting lounge has been rearranged so that there is single patient at a time in the waiting lounge, and the next patient will be allowed inside the clinic only after this patient is properly explained about the treatment, directions, the prescription, and the future appointment. Everything ophthalmic assistant explains to the patient, and all satisfied, the file is handed over the patient, again maintaining the proper social distance, and this patient straight away leaves the clinic. And after he leaves, the disinfection process of the consultation room follows, and once this disinfection of the hands, of the seating of attendant and the patient is complete with the disinfection spray, and the slit lamp is similarly cleaned with the help of a soaked mop with the disinfection solution. And once this whole arrangement has been thoroughly disinfected, only then the next patient will be allowed inside the clinic. So dear viewers and dear patients and clients, yours and our safety is top priority at Acuity Eye Centers. And we pray to the Almighty Allah to keep us protected, guided and blessed always. Thank you very much for watching.